We're out here sitting on the deck with Dr. Zannos, Grekos.
Morning.
We just had the stem cell transfer or the injection of stem cells yesterday. Checked me out and said I'm doing good. This is Dr. Grekos.
Morning.
And, maybe you could have him just talk a little bit about what he did to me.
So yesterday we did the redelivery of the stem cells. We go in with a catheter from the femoral artery, which is at the top of the leg, up through the vascular system, the aorta, into the left pumping chamber of the heart. And the catheter has a tiny needle that pops out the tip, and we inject small injections throughout the myocardium, which is the heart muscle. We do about 20 injections and implant the stem cells that we harvested. 2 days prior, we took stem cells from fat and from bone marrow, concentrated them, added growth factor specific for heart growth and vascular growth. Then we put them in a bioreactor that spins them so that they maintain kind of zero gravity. And we pick that up from cells blown up in space. And then they're reconcentrated on the day of delivery. We do a viability count. We look at them under a microscope, and then they're concentrated and they're injected back through the catheter. And that's what you had done?
Yeah,
Yes, that was yesterday.
And there were some other patients too that had brain.
We did a lady for dementia. It seems to work really well. We had another young girl that has had seizures her whole life, and stem cells reduce the seizure activity. So she's had this is her third treatment. With the first two treatments, she's had like a 98% reduction in her stem cells, and with her seizures. And with this one, we're hoping that it'll be 100%. So she's already gone back to college. She's writing a book, and she's looking to start the school of chiropractic. She wants to be a chiropractor. So hopefully this will do it.
Was another patient that had renal kidney issues.
A lady with renal failure and prior to dialysis. So we're hoping to be able to walk her kidneys back so that she doesn't have to go to dialysis. And then another lady with severe COPD lung disease that is doing extremely well this morning. Everybody has actually done very, very well.
So do you do knees and things like that?
We do orthopedic procedures as well. It's not something that we concentrate on. Orthopedic procedures are allowed to be done in the States by the FDA, so we don't need to replicate. If somebody has what we do is several notches up from what can be done in the States. If somebody has some very severe disease, then we can treat them here. We do spinal cord injury, both cervical and thoracic. Paraplegics and quadriplegics do very well with this. So there's a number of different diagnoses that can be treated with stem cells. And then there are some that just it doesn't work on. So it's a matter of patient selection and having some clinical experience to know if it's something that the patient will respond to, because we don't want to put somebody through something that incurs risk without any benefit.
I see.
Well, it's been an interesting week here. Looking forward to the results. And I know there's a lot of people interested in stem cells for their own issues, hearts and other things. So I guess I can forward these people off to you and on their Facebook page and website.
I'm happy always to talk to people that have an interest or give them advice. I mean, whether it's stem cell or not. So if it's something that I think they might benefit from, I'll let them know. If it's something that can be done in another way, conventionally or back at home, then that's what I'll let them know. I'm sorry, I'm going to say this in the video, but I keep looking in your eyes rather than the camera. So.
Which is just fine, because
it
looks like you're looking right at the camera.
Okay.
That's my filming.
I'd rather look at your eyes, so we're all right.
I do have a question about the biggest hurdle of not being able to do these procedures in the States. Why do we have to come to the Dominican Republic and
outside the country?
Outside
I mean,
the country.
Other places that the stem cell procedures are being done. I became first involved with stem cells in 2006, so that's 13 plus years at this point. And at that time, I thought to myself, "Oh my God, this is amazing! I need to work with this. This has to be something that I'm involved with, and we'll be doing this in the States in 5 to 7 years." And it's been 13 years later. Not only are we not doing it, it's actually been walked back. I've been to Washington. I've spoken in front of the Senate. I've spoken to senators. And what I've realized is that until the pharmaceutical companies can figure out how to patent your own stem cells, which they can't, they've been trying, we're not going to get it in the States, because it's going to reduce the amount of medication that patients need. It reduces hospitalizations. It reduces the need for defibrillators and pacemakers. If it's hearts, surgeries, and there's going to be a whole transplants. So there's so many industries that are threatened by the use of stem cells that, from a profit standpoint,
It would hurt them.
it is. And
Yeah.
so I think that the only way that we're going to see something like this in the States is through a grassroots effort. If there's more and more patients that are demanding this, and the government eventually has to listen to them rather than the pharmaceutical lobby.
Good luck with that.
Well, maybe a final thing to talk about is, now that the stem cells have been implanted, how long does it normally take to see improvements, and how long does that last for?
So with stem cell treatments, everybody's a little bit different, but generally with a cardiac patient, you tend to see some initial benefit even within the first few days, because the stem cells will optimize cardiac function and other bodily functions. It's called a paracrine effect. And then over a period of 6 to 12 weeks, you start to see permanent changes with improvement in ejection fraction, a decrease in cardiac size. You see about a 10 to 20% decrease in end diastolic volume, which is just the heart size. Decreased shortness of breath, better fluid mobilization, so you need less diuretics, better functional capacity, sleeping better, less symptoms of congestive heart failure. And then long term, what we see is significantly less hospitalizations. I would say 90+% of our patients don't end up in the hospital again after they've been treated. We just eliminate rehospitalizations for congestive heart failure. And we have prolonged survival. So our patients live longer. The first patient we treated in 2006 had an ejection fraction of 18%. He had a 50% mortality at like a year or two. And he opened his 3rd restaurant recently, and he works full time, and he's not taking any medications. His defibrillator got turned off a few years ago. His ejection fraction is up in the 40s, and it stayed.
Oh my gosh.
So it's mind-blowing. It contradicts things that we are generally taught in medical school and in residency and cardiology fellowship. You can't. Now, can you bring everybody's heart back? No, obviously. Not everything in medicine is 100%. But the majority of patients tend to see a significant improvement in their overall cardiac function. They tend to do a lot better. One of the important things is that patients don't wait until the last minute. Yeah. It's a lot easier for me to bring heart function back in somebody that's not on oxygen, not in a wheelchair, not with a ventricular assist device, not with an ejection fraction of 8 or 9%. So somebody that comes to me as a walkie-talkie, as we say, tends to do a lot better.
I should have came earlier myself.
He should have 14 years ago.
You know what? Not only do you need to be physically ready, you need to be emotionally ready for it.
Right.
And then, so you were saying the improvements can continue for about a year?
You continue to improve for up to a year, sometimes a little bit longer, so the heart gets stronger and stronger and stronger for that period of time. But they last. I mean, like I said, I've been doing this for 13 years, so I've seen results last for 13 years so far. So next year I can tell you that I have results that last 14 years. If you had asked me 5 years ago, I would have said, beyond 6 years, I don't know how long they're going to last. But we're seeing really long-term results. We really are. And generally, it's just the one treatment.
And it's pretty amazing, if you go on the regenosite.com or on the Facebook page, you see a lot of videos of different patients, and it's really mind-blowing to me seeing some of the people with spinal cord injuries, and you know, those are things you just always assumed were permanent, and people are improving in function. And
I spoke with a young lady that we treated.
cystic fibrosis is another one.
Yeah, there's a lot of things that can be treated. There's a lot of things that can be treated that we don't even know can be treated. So a lot of times new diseases or new diagnoses that I treat are because somebody called me up and said, hey, can you treat this? And then I've got to kind of think, well, we've treated something similar, or stem cells behave this way, and this is what you've got. So the answer is yes, or the answer is no.
Can you treat diabetes when it's
diabetes is more challenging. So patients with type 2 diabetes that we treat other things, their hemoglobin A1C improves, their insulin sensitivity improves, so they get better. So type 2, yes, seems to respond. Type 1, once the pancreas is burnt out, would be more challenging. Yeah, and I haven't focused on that enough to say how successful it would be. Now there's other groups. There's a group out of Northwestern in Chicago that has done some work with type 1 diabetes, and if you treat it early and you do some immunomodulation initially, they seem to have some pretty good outcomes. But you know, I'm not a diabetologist, so you know, I like hearts. You know,
Yes.
I like you know, from here to here. That's the area that I like to treat.
Well, we're thankful for that.
Anyway, you guys, this is
blessed.
Dr. Grekos, and we're blessed to have him.
Yes.
And it was a step of faith, but you know, a lot of the people that were here on this trip had actually gone through this process with him before, and we heard a lot of amazing stories, and it's really been a pleasure, and thank you for helping us along this journey in life. I'm looking forward to doing a lot more in life now.
Dude, you will.
Yeah.
You will. You will.
Yes.
Okay, looking for
Thank you.
We have the guarantee then. Okay, guys. Well, thank you. And
Okay.
this is
Thank
Dr.
you.
Grekos again.
Aloha.
The man.
Aloha.
Okay, aloha, guys.